It's 9:30, so should we begin? Dr. Amin, are you okay? Should we start?
You want to give them a couple of minutes? It's the exact
Okay.
9:30. Just give a couple of minutes more. There are 21 people. I think we'll
Okay.
wait till at least we cross 25. Or we can start with the introductions and also that will take some time.
Yeah, but I don't think anybody from the committee is really joined as yet. Then we'll have to start off right away. You want to try and call her?
We can welcome them whenever they join in.
Sure.
If they join 15 minutes later, then pointless waiting for them.
Right. So, a very
21
good
will-
evening and a warm welcome to all of you to this very informative, a very novel, and at the same time, an extremely important module regarding HPV vaccination and cervical cancer prevention. I take my words back, let it be HPV vaccination, because as we know that it's just not for the prevention of cervical cancer, but also for a whole lot of cancers in males as well. So incidentally, we are at the Cervical Cancer Awareness Month. The month of January is celebrated all over as the Cervical Cancer Awareness Month. And this is the best time to take this module to create an awareness and sensitization amongst ourselves as our primary health givers of all the kids who come to us. So let us be aware of how important this vaccination is in prevention of something as deadly and as life-threatening as a cervical cancer, the second most common cancer in women in India and also globally. And probably the recent statistics say that every 5 to 7 minutes in India, there is one life which is lost because of invasive cervical cancer. So I think all of us who have joined this module today, at least at the end of the module, let us be very convinced, very sensitized ourselves, and pledge that all of us are going to be like an HPV vaccination champions and try and propagate this so that probably in the coming decade or more, we are going to look at a cervical cancer free country in us as well. And I'm extremely grateful to have with us the National HPV Project Coordinator, Dr. Purna Kurkure, Madam. Madam, thank you so much for coming and gracing this. Madam has also been the HPV Project Executive Lead. And I welcome Madam. And Madam, if you could just say a couple of words and about the module and welcome everybody.
Can you hear me?
Yes, Madam.
Yes, ma'am.
Good evening and thank you to IAP Mumbai, our own branch, to take up this TOT today at the fag end of the day and the enthusiasm with which people have joined. I welcome you all. And as Nehal has very rightly pointed out, that it is for us to get sensitized, to motivate the parents to take up this vaccination. We as a pediatricians, we are all very attuned to advocating vaccine in under 5 population. But when it goes above 5, you have to make an extra effort. And this vaccine is being advocated between the 9 and 14 years age. It is as such gender neutral vaccine. It can be given to both girls and boys because it prevents not only cancer cervix but other cancers like oropharyngeal cancers, penile cancer, anogenital ward. So many other conditions also it prevents. But the thrust is on the cancer of the cervix, prevention of cancer of cervix, because of its large number. Cancer of the cervix is second cancer causing morbidity and mortality in urban population like Mumbai after breast cancer, and in rural population in some pockets it is still the number one cause of morbidity and mortality in the woman. So if we can prevent, these are some preventable cancers, some through the lifestyle and some through the vaccines, like we have experienced that with HPV, and now we have this HPV vaccine which will help us in eradicating cancer of the cervix. And WHO in 2019 declared that we can achieve this elimination globally of cancer of the cervix if we follow the 3-step procedure. 90% of the girls to be vaccinated between 9 to 14. 70% of the women above 35 should have at least 2 HPV screens during the reproductive life to pick up any precancerous lesions. And those who are picked up as a precancerous lesions, 90% of them should have an early management to avoid the morbidity and mortality. And with this 3-prong approach, we can really look for elimination of the cancer of cervix, which is so prevalent in low and middle income countries. This is a problem of us, low and middle income countries. Western world, the screening has been going on very diligently for many, many years, and they have seen the fruits of that in form of lesser and lesser. Now, in India, at least the menstrual hygiene has been talked about very, very vehemently. So if you add all these measures, we can also eliminate. And I'm sure we will be able to succeed in that. And our mission starts now. After we attend this TOT, we have to take it to our regular practice, into the community, and sensitize everyone about this vaccine, and see that the vaccine take is to the maximum, to the tune of 90% in the community. And fortunately, this is the right opportune time. We have our own indigenous vaccine from Serum Institute, besides many others which are already available commercially. And government has taken up vaccination of all the girls between 9 and 14 in 6 states to begin with. So by mid of 2024, we should have the access, and hopefully post election, the things will get rolled out. And our underprivileged girls also will get benefit. Already the privileged population is going for vaccination, and we should continue doing that and be advocate for that. So I thank you once again for this taking up this module today, and happy learning, and take it forward as a mission in the coming months. Thank you.
Thank you so much, madam. Thank you. That was really a very motivating message that you have given all of us to begin with. And just before you joined, I told them that one thing that we need to do today after this module is become champions and propagate this vaccine completely into the community. So thank you very much. And we also have with us Dr. Jitendra Gawane, who is the national project convener. And I would request Dr. Jitendra to quickly say a couple of lines on this module. Dr. Jitendra? Dr. Jitendra is there?
Yes, he is very much there.
He
Yeah.
is there, but I think he was in the car, so probably
Okay.
might not be able to talk or
Okay,
something.
maybe we can, yeah.
I
And
think
of course,
he
it's
was in the car.
right. And on this occasion, also, I would like to make a mention that it is Herculean efforts of Dr. Purna Kurkure, madam, along with our immediate past president, CIAP, Dr. Upendra, along with the president of the FOXY and the Cancer Foundation of India and the American Cancer Society, that this module is rolled out. And we'll be happy to take this module as the maiden one in our branch today. We have with us the core trainer of the West Zone, Dr. Amin Kaba, who is also going to be one of the faculty with us today. Dr. Amin, would you like to say something? I think he's frozen. Okay. So I think with that, those few introductory words, let's begin with the module. Amin, can you do slide sharing? I don't know what happened. Amin?
Amin, you are frozen.
Amin? Yeah, we have Dr. Jitendra. Dr. Jitendra, can you?
Jitendra, you speak. You are also off the screen for a while.
Yeah. Good evening, everyone. Respected Purna ma'am, respected Rajesh Chokani sir, Nehal ma'am, Amin sir, and all dignitaries of Mumbai branch. Friends, with lot of efforts, this project Madam Kurkure has got from American Cancer Society in association with other 3 societies like Cancer Foundation of India, and we are first time collaborating with the Federation of Obstetrics and Gynecologists. Only reason being 77,000 women die because of cervical cancer every year in India. And now government is planning to introduce this vaccine in a phased manner in coming years. So there is a hesitancy in people, that is okay, but there is a lot of hesitancy in offering this vaccine to patients in our pediatrician colleagues also. So as we are moving towards the universal immunization program, we should remove our hesitancy and strongly recommend this important vaccine, which is available since 2006, to the people, so that they believe us as a strong advocate of vaccine, and they follow what we advise them. So our other colleagues also, like our IMA colleagues, general practitioners, and the healthcare providers which vaccinates, they also become confident when we, as a pediatrician, as advocates of vaccines, are offering this vaccine to them. So let us clear our all doubts, and after this program is over, let us uh, educate the other people like IMA members and other as a trainer to propagate this vaccine whenever opportunity comes. So all the best, Neil ma'am, and please keep this WhatsApp group alive, so that every month we will send the posters and prompts, and we have to submit that with a Google link to the American Cancer Society, and they will assess the program validation also. So thank you and all the best.
Thank you so much, Dr. Jitendra, for those words. And I think Dr. Amin has some technical problem. He'll take a couple of minutes. So as Dr. Jitendra rightly said, that this closed group is going to have the privilege of getting all the updates, all the necessary circulation material, posters, videos, which can be displayed. So we will keep this group live. And of course, for logistic purposes, there will be a couple of things that we request everybody to do. Number one, this is going to be an interactive module, and this is going to be documented. So kindly requesting everybody to keep their videos on and also rename themselves. So probably you can go in the chat and click on the participants and rename yourself, your complete name, your affiliation to an organization. So with us, it is going to be the Indian Academy of Pediatrics, and the location. So maybe Vile Parla, Mumbai, or Bandra, Mumbai, whatever. So these three things are extremely important if you can do that. And also put it in the chat box, because this is all going to be, all this data is going to be taken care of in further this thing. So before Dr. Amin joins in, I think if everybody can do that, it would be great. So
Nehal, you can share the link for the survey, pre-survey.
So madam,
Amin is,
I have not taken it on this.
Jitendra, can you just?
I'm back.
He's
You are
he's
back?
come, madam.
Okay,
He's
okay,
back.
okay.
He's back.
Yeah. So extremely sorry for that glitch. The computer has a mind of its own. It just decided to shut down. So I'll not waste
You
any
can
time.
start
I'm
the
gonna start.
slide sharing.
I'm starting it right away. Yeah. Nilesh will have to allow me to share screen.
Nilesh?
Yeah, it started.
Yes.
It's done.
Okay, so this module is going to be all about the medical societies leading the way to cervical cancer elimination in India through HPV vaccination. We are going to take up a small pre-test survey or a pre-module survey, and requesting everybody to have access to this survey. I mean, next slide.
Yeah.
Yeah. So I think everybody can probably take this survey, and we'll give 30 seconds, 1 minute to kind of finish this pre-test.
You can scan it directly from your mobile. And you can directly go onto the link. It's important to fill up this survey because that marks your attendance, as well as uh, it's important that your attendance is recorded, so that certificate can be given of that you attended this training. I'll just go back. And as soon as people are done doing the survey, can you just put a thumbs up in the chat that you've done the survey, so that we know that people have done it? You need to show a thumbs up.
Dr. Ghazala, do you
what's
want to scan it again?
You can just open any QR code on your mobile, it will take, or you can just copy this link onto your browser and then you can do it. Dr. Jitendra has put it up on the chat also. You can directly click from there as well. Edit mode.
So I think few people have really finished. So I think we can go on. Shall we continue?
Yeah.
Okay, so this
need a few more show of hands. Yeah. So first disclaimer to this, the science has already been reviewed by the American Cancer Society, and none of the pharma industry representatives are involved in development of this content, and we do not endorse any company or any kind of service through this training. The project focus is we are planning to train over 10,000 members to this for this project. And the first part entails the training and the know-how about the HPV. And the second part will be communication strategies. There will be a monthly check-in post-training where a prompt will be sent to you from the central IAP, where you need to respond to those prompts and act on them. This is the team. You can see Dr. Rishikesh Pai, who's the president of Oxy, and our immediate past president, Dr. Upendra Kinzavadekar, who was instrumental, and you can see Purna Kulkarni ma'am as well, Dr. Vijay Yevle. These are the known faces that you would see. These people are responsible for kickstarting this project. We have a short message from Dr. Upendra Kinzavadekar.
So friends, I think this is a great day. All of us understand that prophylactic HPV vaccination is extremely powerful strategy, and we have to reduce, and not only reduce but eradicate HPV related disease and cervical cancer. We have all understood the efficacy, immunogenicity, safety of this vaccine, and since I think it was introduced in US HPV in 2006, I think it has gone multiple changes as far as the age, as far as dosing schedule, as far as gender preference. Everything is changing, rapidly changing. But despite these changes, the basic tenet remains the same, that we have to prioritize immunization before initiation of sexual activity and subsequent exposure to HPV. I think there is no second doubt about it. The importance of immunizing males and females equally and the role for catch-up vaccination in late adolescence and adulthood has also been supported. Till 2011, I think we were not talking about boys getting vaccination, but then of course now we have understood that if we want to reduce the HPV related anal and oropharyngeal cancer, the vaccination of boys is also extremely important. Despite this overwhelming evidence regarding this reduction of HPV infection, anogenital warts, I think pre-invasive disease in both vaccinated and unvaccinated population, the implementation and uptake, I think in both low and high income countries continues to be challenging. And that is the precise reason why we are having this program today. Barriers are actually multifactorial, and I won't say it's only about accessibility, affordability, availability that we always talk about, but fourth is more important, the awareness, and we have to really pull our sleeves up to make every individual aware of such vaccine being available to prevent this disease. Infrastructure limitations, social stigma are also there. Dosing recommendations continue to evolve, and it is going to happen It's an ongoing change, and I'm sure the day is not far that just we have a two-dose schedule. It's going to be single dose schedule, will of course confer durable immunological response. It's going to happen one day. This is especially relevant for a country like mine, India, where really the burden is high and access to multiple doses of vaccine is really more difficult. Finally, I think I would like to end this my address on a positive note and give an example of Australia. In January 2019, the Australian researchers made a bold statement, and listen to this statement, that they said cervical cancer would be eliminated as a public health problem in Australia in next 20 years. And what confidence? Why did they make such statement? It's because the nationwide HPV vaccination and simultaneous cervical cancer screening program and their outcome and predictions are extremely promising and exciting for a country like India. So I think organizations like Cancer Institute, American Cancer Society, our own IAP, FOXY, we are all putting forth our educational campaigns, funding, and we have to continue our efforts until at the minimum coverage for HPV vaccine years that of other our common childhood vaccines. And we are going to all be successful. We are starting on a great note, on a wonderful day, and I'm sure this program is going to be successful. Thank you so much, and let's all continue in our mission till the last individual understands the importance of HPV vaccine. Thank you.
After that message, these are the national coordinators, Dr. Priya Ganesh Kumar and Dr. Purna Kurkure. We have a welcome message from ma'am. Ma'am has already addressed. Should I continue with this?
I mean, you can keep it.
Okay.
I want save time.
Thank you, ma'am. So we'll be the trainers. Dr. Nehal Shah, the master trainer for the West Zone, and myself will be the co-trainer. So this is the agenda. The module 1, as I said, we'll talk about cervical cancer elimination and the HPV vaccination facts, followed by a Q&A if we have time. And then the module 2 will handle the communication strategies. A small note to everybody, everyone needs to keep the camera on throughout the session. The small group breakout sessions we'll have a common communication strategy thing later on. I request everyone to rename yourself on Zoom. You can put your name followed by organization and your location. And this is how you do it.
Most of them have done it. I mean, you can skip this. Most of them, everybody has done that.
All right. So talk about module 1. We'll talk about the cervical cancer burden first. See this figure, absolutely crazy. So more than 77,000 women die every year. That comes to almost one woman dying every 5 to 7 minutes in India because of cancer, cervical cancer. We had a video of a cervical cancer survivor, but I think we're going to skip on that one. And this is the most important slide of all. When we talk about it, this is the WHO's master plan in achieving elimination of this deadly virus and cancer. Vision is the world free of cervical cancer, by which can only be achieved if you have 90% vaccination by the age of 15, 70% of screening at the age of 35 and 45, and 90% timely treatment, where the women identified of the cervical disease and received treatment for the precancerous lesions. The best part about this cancer is it has a very long pre-invasive stage, almost up to almost 2 decades. So if the patient is picked up in time, they can very well be treated in time. And these are the pieces, how it has all come together. So India's first HPV vaccine has been launched. It's going to become a part of the UIP. The Ministry of Health and Family Welfare will be following up on the catch-up campaign. And our role, which is one of the most important part of this jigsaw puzzle, where a strong physician recommendation is needed. Why should we do this? So we all know that physicians are the most trusted source of HPV vaccination information for parents. And if the physician is not confident about the vaccine, the parents are not going to take it. We have to take it onto ourselves. We have the onus that we need to convince the parents that how important the vaccine truly is. And we need to increase the HPV vaccine coverage in girls as well as in boys. We'll come to that also later on. And more than 80% of cervical cancers can be prevented through HPV vaccination. And together we can eliminate cervical cancer in India. The burden that we talked about. See the number of cases in 2020. 604,000 cases, and 90% of these cases are in lower and middle income countries. And more than 342,000 deaths, of which 90% again in low and middle income countries. As we all know, we are one of the highest populated countries in the world, and we contribute a major chunk of these. I mean, more than 1/5 of these deaths are from India. And astounding fact, more women now die from cervical cancer during childbirth. Our maternal child health practices have become so much better now that we have much lesser number of the maternal mortalities, but the cervical cancer deaths are still very high. This is the chart we can all see where India is a nice deep red color, and you can see the developed nations. You can see Australia, as Dr. Kinzavdekar has rightly mentioned, that how they have successfully controlled the cases over there. As we said, we have 77,000 deaths annually, and if we don't act now, the new cases will increase by 54% in the next 20 years. And our action today can change this picture for tomorrow. And where does the ripple effect come? So everyone, the women, we know that they have an important part of the society, the teachers, the caretakers, our mothers, the future of the society. They are also income earners now, the workforce and the leaders as well. So we need to really take care of our women, make sure that they are protected from this deadly cancer. This is a statement by WHO Director General, Dr. Tedros, and he says that the cervical cancer strikes women in the prime of their lives, and that's what affects a major part of the economic fabric of the community. And if you don't act now, the deaths will keep rising. But it doesn't have to be this way. A little note about the virus. More than 200 types, in fact, have been identified, and at least 14 types have been associated with 6 types of cancer in men and women. So it's cancer of the cervix, the vulva, the vagina, the penis, the anus, and as well as the oropharynx as well. Now, remember the infection is gender neutral, is going to affect men and women alike, and estimated that more than 50 to 80% will get at least one type of HPV infection during their lifetime. But most of these infections will not have symptoms, and the body takes care of these infections in about 2 years' time. But not every time the body is successful to do it. And if the HPV does not go away on its own, that's where it starts affecting the healthy cells. Remember, it's not only through sexual contact, it's through intimate physical contact as well. It's spread through skin and skin, and can be exposed through can be spread through a single exposure itself. Condoms provide a very limited protection, so they will not protect against HPV spread. And it can be spread even if someone has delayed penetrative sex till later on. As I said, vaginal penile intercourse is not required, and that's why vaccination is the most effective method of primary prevention. So what happens really? So we have a small pictorial over here, wherein the normal cells get infected by HPV, they go on to precancerous cells, and if the body is not able to clear it off and the infection persists for 5 to 20 years, that's when it transforms into a cancer. Now, which infections can become cancer? So, high-risk HPV type and the ones which are persistent, which the body is not able to clear over time. In India, 84% of the cervical cancers are caused by types 16 and 18, and the persistent HPV infection is the one that ends up causing a cervical cancer. And a good hygiene is very important for the overall health and well-being of the woman. HPV vaccination is the best way to prevent infections and cervical cancer. So, what is the prevention strategy to reach elimination? HPV vaccination in girls at 9 to 14 years of old, and cervical cancer screening at 30 years to 65 years of age. We have a slide wherein we talk about the FOXY recommendations, how and when the women should get screened for the same. And this is a picture of both the obstetricians and gynecologists coming together along with the CFI and ACS to eliminate this cancer. Let's talk about the vaccine now. HPV prophylactic vaccine is a recombinant L1 capsid protein that forms virus-like particles It's non-infectious and non-oncogenic and produces much higher levels, almost more than 1,000 times levels of neutralizing antibody as compared to a natural infection. The natural infection confers only a local immunity which is not able to clear off the infection. What are the approved vaccines? The bivalent GSK vaccine, which covers HPV 16 and 18. This has been withdrawn and no longer available. There are two quadrivalent ones from MSD and one from the Serum Institute of India. Both cover 16, 18, 6 and 11. And there is a 9-valent or nonavalent, which covers 16, 18, 6, 11, 31, 33, 45, 52 and 58. So these are the ones that we talk about. So as you can see, 16 and 18, the ones, the third and the fourth one, they cause about 84% of the cervical cancers in India. And the 6 and 11 cause 90% of the genital warts. So when you're covering with the 4 of them, you're covering 84% of the cancers and 90% of genital warts. To cover the rest of the 15%, we go up to almost 99% coverage. That's where the nonavalent comes in, where if the patient is able to afford it, then they can go ahead and even take that vaccine and get protection from the other serotypes which end up causing cancer. Vaccination facts. HPV vaccine is effective. HPV vaccine is safe. Vaccination starts at 9 and your recommendation matters. These 4 lines will keep coming again and again and again. And these things have to become like your normal breathing. You will be seeing this all the time when you talk to the patients. So when we talk about effectiveness, look at the numbers. I mean, Sweden, 538 cases in unvaccinated women and 19 cases in out of 518,000. These are two groups that they're divided into. So see the fall in the numbers. And only 2 cases in 10 to 16 years of age who had been given vaccination. And only 17 cases and 90,000 of the people who had been given vaccine between 17 to 30. And that is the reason that we need to vaccinate the patient, the women much earlier, between 9 to 14 years of age. That's when the protection is maximum. The antibody level induced is much higher at that time. These are a part of Indian trials. You can see that unvaccinated are the ones which are the maximum CINs, whereas all vaccinated, we had 0 cases. When we talk about safety, 160 studies in several countries, more than 175 million doses given all over the world. No serious side effects other than what's common for all vaccines, like simple pain at the site of reaction, maybe a febrile reaction, some fainting, and maybe some allergy. Long-term safety data, this vaccine has been around for over 2 decades now. So the timeline also has been shown over here. In 2011 itself, we proved that there is no greater risk of anaphylaxis or GBS or stroke or blood clots or any kind of seizures. No autoimmune disorders, no thromboembolism, no demyelinating illnesses, no primary ovarian insufficiency, no rheumatological conditions. And this is one question that comes in, that does HPV vaccine harm the fertility? Many patients will come to you with this saying that, oh, it's maybe a conspiracy by the government to kill the fertility of women. This had come out even during polio vaccination as well. Has come up sometimes even during MR vaccination. But HPV vaccine is a safe way to protect the health and ability to have healthy babies and not the other way. When does it start? It starts at the age of 9. And when we give it in time, you require only 2 doses between the age of 9 to 14 years. If the child has crossed the age of 14 years, then 3 doses are needed. And if it's an immunocompromised patient at any age, it's always 3 doses. Please remember that all vaccinated girls should also follow the cervical screening guidelines into adulthood as well. This is what I was talking about. Earlier the age, the more effective the vaccine. You can see how the effectiveness against cervical cancer has dropped to almost to 62% when the vaccination happens in the later ages. And between 16 and 18 has gone down to almost 34%. So that's the reason we need to vaccinate as early as possible. The reasons that you need to remember and need to reiterate to your patients, that it gives you more time for completion in time before the age of 15, a better and a stronger immune response. We all know that children react much better to vaccines. All our childhood vaccinations, we know that the children are, the reactivity is much better and the immunity conferred is much long lasting. Increased likelihood as the child ages. There are lesser questions about sexual activity by the parents and the guardians. And since the vaccinations will be increased, the cancers will be prevented. And we have seen that all across the world that the vaccinations are much easier taken up in childhood as compared to an older age group. The science has been proved without any doubt that the path to cervical cancer elimination is possible through regular vaccination. As you said, this is the WHO elimination strategy that 90% of the girls need to be fully vaccinated by the age of 15. At least 70% of the women should be screened using a high performance test by the age of 35. And again, 45, the minimum 2 screenings are recommended. That's minimum, bare minimum that we're talking about. And 90% of the women with pre-cancer should be treated in time so that we can save them. As you said, this is a historic moment for global health, and this marks the first time that the world has committed itself to eliminating a cancer. I mean, such a fantastic thing that a vaccination given in time can eliminate such a deadly cancer. We have a message, the video by the gynecologist as well. This was actually a request that had been made by a few of the earlier trainees that we need to know what is the actual recommendation. The good part about it is the slide is directly available because a repetition of all that we've said already. So when to start screening, I mean, all these are available on the Foxy website, and the resource material also will have the links to the same. But you can see that the age to start screening is at 25 years in a good resource setting, and a universal recommendation first time at the age of 30. And to end screening is at 65 years when 3 consecutive negative cytology results are present in the last or 2 consecutive negative HPV tests within 10 years. And the last one should be within the last 5 years. Screening intervals have been mentioned, that a cytology every 3 years. And in the minimum resource settings, we need 2 screenings, one at 35, one at 45. Screening after hysterectomy and removal of cervix. You don't need to have any kind of the hysterectomy is done for a cancer or breast cancer, then the screening has to be continued. Otherwise, you don't need to screen. If there was no cancer and there was some other cause to remove the uterus. And for immunocompromised also, you start at 25 and they need to be screened more often. Dr. Nehal, I'll be skipping this slide. Is that all right? Because it's a repetition of everything.
This was the message that we wanted to convey, that what are the basic levels of screening, which is already covered. The rest is all we can let go.
Yeah. So that covers the science part of it. Do we want to take the questions now, or you want to take it at the end of it?
I think they can put up questions related to the HPV virus. I think they'll be very minimum. Anything regarding the HPV vaccine, which is clearly pointed out that the immunization schedule is going to roll with a bivalent, which is going to take care mainly about cervical cancer, which is the focus of the entire module, to try and get cervical cancer free elimination in the next 2 decades. And the quadrivalent, which is going to prevent the anogenital and the warts as well as cancer. And the latest nonavalent, which is going to prevent everything, all 3 of the problems coming up. So I think related to that, whatever questions are there, people can put up in the chat box. And at the end of module 2, we can probably take it up together. Is that okay with everybody? So I think we'll go to module 2 now. So this break is virtual. I think people who want to have water or tea or coffee or something can continue doing with this. Okay, so this is a small video by...
You want me to play?
No, I think
it's
we
about
can...
vaccine choices and all. I mean, we'll have more time for communication strategies later. That will be better, I think, rather than seeing this video.
Sure. So so module 2 is basically about strategies to effectively communicate about HPV vaccination to our parents. So this is very important because as health givers, if we are going to be very convincing and we are going to be completely sensitized at the end today that this is so important, then our communication strategies are definitely going to make an impact on all the patient load that we are going to have to start making HPV vaccination very mandatory in our patients. So it's all going to be about the parent beliefs. What are the common questions that we face? Making a recommendation, which is very important from our point of view, and then telling them about the facts of the vaccine. So again, this is a small video which is on cervical cancer as one of the preventable cancers. And I think we can actually go away. So do you want to play this, Dr. Amin?
Whatever, it's Soumya Swaminathan, who was the
Yeah, she was a
WHO.
vaccination champion. And it's a video regarding this only, that communication strategies, how they can help. And
Should I play it?
how many minutes is it?
I think it's about 1.5 minutes.
Yeah, we can probably play that.
I'm Soumya Swaminathan. It is quite tragic that every year about 60,000 women die of cervical cancer in India alone. We know that cervical cancer is one of the preventable cancers because it is caused by infection with the human papilloma virus, and we have a vaccine against HPV. 2 doses of this vaccine given to young girls between the age of 9 and 14 years can effectively prevent both infection with HPV as well as precancerous lesions which arise due to chronic infection with HPV. Many trials have been done around the world to show that this vaccine is safe and effective. I think it's our responsibility as doctors to really make sure that we explain to people why HPV vaccination is essential for young girls. And in the future, if we are to eliminate cervical cancer among women as a public health problem, it is absolutely essential that we advocate for HPV vaccination for girls.
So of course, don't wait and vaccinate. This is going to be our motto as we go away with this module now. And you'll have to stop the video. So in a nutshell, Dr. Soumya pointed out that how important it is going to be for us to communicate. And this module, the module 2, is going to be based on few things related to the communication scenarios, which we are going to deal with later on. And regarding the parent beliefs on the vaccine and how a primary health giver, or how we as the doctors can kind of get away and convince them why this is important. So what are the challenges that we are going to face regarding this HPV vaccine, what policies, what decision making. So I think the module 2 is going to just work around these basic questions. Next, Amin. Okay, so what are the parents' beliefs? So there was a mother from Howrah who read up that vaccines are quite important. There is no other alternative means to prevent diseases. And this is the general tendency that most of the parents feel and take, that vaccination still remains the most important preventive tool to many life-threatening, morbid and mortal diseases in childhood. They want their children to be healthy in the future and of course free from all these diseases. They do believe that vaccines keep children safe, healthy and prevent these diseases. And they consider vaccines to be safe and beneficial to their child's health. This is in general what parents feel. And why and what comes important is the parents really trust their doctors. So for them, the position of the doctor is only after God, and only doctors can cure us, is what they tell, and what thing they have, what mindset they have. There was a father who also reacted saying that when the doctor tells me something related to my child's health, I trust him. Since he is attentive to my queries and doubts, it helps increase my trust in him. We go to the doctor to cure our diseases, and it is the doctor that heals us. So we have to rely on the doctor, and the opinion of the doctor must be given importance. Now, what was the whole point in pointing out these two quotes to you? That this is the kind of belief that all these parents have in us, and how our recommendation and our communication is going to cause an impact when we are going to put forward HPV vaccination. So parents consider healthcare providers the most credible source of information on HPV vaccination. And that is why our recommendation does matter. So the first important point today is making a very strong and a clear recommendation. How will we go about? So we will note the child's age, tell the parent that girls this age are due for a vaccine that can actually prevent cervical cancer, and recommend that they should vaccinate. So how would that go around in a model way? That Preeti is a 9-year-old, which means she needs her first dose of the HPV vaccine, which protects her from cervical cancer and many other HPV related cancers. Cervical cancer is very common in India, and I strongly recommend that you should get her HPV vaccinated. This is a very clear recommendation that will come when we see a child who is going to come at this age to us. Next. So after we have made a very clear recommendation, we need to connect. So the parent will always have that, does she really need to do it? She's still so young. So the parent has a hesitation. And whenever there is a question coming in from the parent, we as doctors can retaliate to that question by putting a question again that, are you wondering that does she need a vaccine at this age? So this kind of reinforces her belief in us that the doctor is attentive, is trying to understand what I'm trying to ask. And then this shows that we are listening to them, and we restate and emphasize. The third point will come that we will share. So the doctor will say that it's best to vaccinate when they are younger, because we will prevent most of the HPV vaccines if vaccinated at younger age as compared to older age. And also put a line that this is an HPV cancer preventing vaccine, and we should strongly recommend this. So this is absolutely a fact-based message. And this can be, kind of backed up by giving them few statistics that we have already discussed in module 1 regarding cervical cancer. The tip will come that when we talk about HPV vaccination as a cancer prevention, the parent may just come up saying that my child doesn't need this vaccine because she's still not married. So we can probably react and say that, yes, I do understand. Many vaccines are given at younger ages to protect from further diseases and future diseases as well. The HPV vaccine prevents cervical cancer in her future and primarily works best when given at an early age. The immunoprotection, the immunoconversion is much higher when you take it earlier as compared to later years. So if a parent declines at the first visit, you can probably take this up at the next visit, the subsequent visit, and try to reinforce the data, share it with them, and kind of convince them. So once that part is done, that even in the next, what else can we do? So at this platform, I would also like to say that in our WhatsApp group, we will share few videos which are endorsed by the celebrities like Shilpa Shetty and Miss Teen India, where they've actually reinforced, and it's very heartening to see that they're already in circulation in a major way on social media. In fact, we have been having parents coming up to the OPDs and asking and inquiring on themselves about the HPV vaccination. So this is just a sample recommendation of how strongly would you put it. That Preeti is 9 years old, which means she's due for HPV vaccine, which protects her, which we already said. And a sample recommendation with screening. That let's book an appointment for your cervical cancer screening. Is your daughter now 9 years old? I do recommend that a HPV vaccine should be given to her to protect her from cervical cancer. So this is how we begin with a recommendation. And now the second part will come that let's practice doing it. So actually in the module, we would have requested that if few of you can quickly put down a recommendation, and of course not in English because we've already seen, but you may be having parents from other strata as well. So if a couple of you can quickly put down a strong recommendation, how would you communicate with them in a vernacular language and share here in the next 30 seconds? It would be convincing on how we go about giving them an idea about this vaccine.
We can give
So
an audio
anybody
message
who can,
also.
audio
Also
message.
is fine.
You may not just, you can just speak very extempo audio, and one of you can probably volunteer. Anybody, just turn on your audio and probably just read out a recommendation in a vernacular language. How you would convince a mother, probably who's come to you, and tell them about a HPV vaccine. Jagruti, you want to speak?
Yeah, okay. So
Yes.
if I have a child who's come to me at 9 years of age, I will tell the mother कि 9 साल के उम्र के बाद बच्चे को सर्वाइकल कैंसर, अब सर्वाइकल कैंसर जो सर्विक्स है वो जो गर्भाशय का मुख रहता है वो, बिकॉज इट्स अ वेरी इंटरनल ऑर्गन, वहाँ का अगर कैंसर हो गया तो बहुत लेट स्टेजेस में पता चलता है। और ये एक वैक्सीन है जो कैंसर को प्रिवेंट करता है, बाकी सारी वैक्सीन को हम इन्फेक्शन को सिर्फ प्रिवेंट कर सकते हैं, पर कैंसर जैसी बड़ी बीमारी को सिर्फ ये एक वैक्सीन है वो प्रिवेंट कर सकता है। और जितने ये एज ग्रुप में 9 से 14 के एज ग्रुप में अगर आप देते हो तो उसकी एंटीबॉडी के प्रोडक्शन भी अच्छे होते हैं, क्योंकि बच्चों की इम्यून सिस्टम है वो जल्दी बूस्ट कर सकती है एंटीबॉडीज का प्रोडक्शन। और साथ साथ में ये भी आपको फायदा है कि 9 से 14 साल तक में अगर आप कंप्लीट करते हो तो आपको 2 ही डोज देने पड़ते हैं 3 के बजाय। तो आपका खर्चा भी बच जाता है, बच्चे को भी एक प्रिक कम मिलता है, और जल्दी एज में अगर आपके बच्चे को वैक्सीनेशन मिलता है तो उसके एंटीबॉडी प्रोडक्शन और प्रोटेक्शन अगेंस्ट कैंसर जो है वो कहीं ज्यादा होता है। तो मैं स्ट्रांगली रेकमेंड करूंगी कि आप ये वैक्सीन अपने बच्चे को जरूर दें।
Awesome, awesome,
Very
Jagriti. Thank you
nice.
so much.
Thank
If
you for
someone wants to
volunteering.
take up something in Gujarati or Marathi, that would be great. I wish Jagruti would have said in Gujarati though.
I can still say it in Gujarati.
I think we'll give someone else a chance if someone wants to speak up. Anybody?
We are a closed group. If anybody wants to, or we'll just go ahead.
Yeah, I mean, you're doing this day in and day out,
Yeah.
so it's nothing
So,
that's difficult.
It's just a practice to reinforce ourselves on how we are going to do henceforth. And now we'll go, the next part of the module is all going to deal with, it's more like a frequently asked questions from the parents regarding the HPV vaccine. So parents always want information about how to keep their children healthy and cancer-free, what are the vaccine benefits and costs, and what are the vaccine side effects. These are the main 3 questions which revolve around when the parents come up when this vaccine is put forward to them. So if a parent asks questions or expresses a worry after your recommendation, you may probably start asking them that, what is your worry? What is the worry? What is hesitating you in taking up this vaccination? So they will probably that, are these HPV vaccines safe? And yes, HPV vaccines are very safe like any other vaccine, and millions of children have received it over the last couple of decades, over 100 countries in the world. And these vaccines are the most studied vaccinations on the market, and studies show that they are very effective. Next would be that, does the HPV vaccine cause any side effects? So again, the other part of the safety purpose, that it is a very safe vaccine. Like any other injection, mild local side effects like a little soreness at the site, a little redness at the site, pain would be there. Very, very rarely a child can have an allergic reaction to the injection. And as with all injections, we would like to keep the child at least for 10 to 15 minutes of observation after he's taken the vaccine. So, will the vaccination harm my daughter's fertility? Now, this is a very frequently asked question by the parents. And of course, the answer is no, that the vaccination will not cause any fertility problems. In fact, it prevents most cervical precancerous and cancerous lesions. So, probably some mother may also come up to say or hear say that a friend's daughter had a reaction to the vaccine. So, should I be worried? So we can tell them that, I can see how this might worry you. The HPV vaccine is really safe. And as we said, that there are no major side effects. And as a doctor, it is sad to see a woman diagnosed every 5 to 7 minutes in India with cervical cancer, which can be completely prevented with HPV vaccination. So here, I think we'll take up a common role play, right, Dr. Amin?
Yeah.
We can just go away with this. So now the second question would be age related. So they will probably say that most of these come for their second boosters at 10 years for Tdap. And this is the best time where we can, kind of sensitize and put this vaccine together with the Tdap that they take. And then they would come up with saying that most vaccines are given at younger ages to prevent diseases in future. So why do we need to give this right now? And again, why so early? You can take it later on also. The child is still not married. Probably most of the children are not even hit menarche. So at that time, we have to reinforce that this works best when it is given earlier, in between 9 and 14 years. And research has shown that on-time vaccination can protect against cervical cancer in almost more than 95% of the cases compared to older ages. So actually data that the immunoefficacy goes down when the age goes up. So that is regarding the age that you can convince them. Then there would be that, is my child really at risk for HPV infection? So yes, HPV is a very common infection, and every woman in India at some point or the other in time, I think every is probably a little more bolder statement, but almost 50 to 80% of the women would have HPV infection at some point in their lifetime. And if the body doesn't clear it in a couple of years, then this may linger on to cause other problems. Before HPV vaccines, nearly everyone got HPV infection once in the lifetime, which of course changed after this. Now, there would be a question saying that can she not take the vaccine after marriage? So again, we can say that the age-related immunostudies, and therefore the need that everybody should get it before the 15th birthday. And here also put in the cost factor, as Dr. Jagruti very rightly said in her conversation, that when you take it less than 14 years, only 2 shots are enough compared to 3 that when the age goes up. The next question would be that how long will the protection from this HPV vaccine last? So it provides you a very, very long lasting protection. And there is enough evidence and research to suggest that immunity given by HPV lasts well into adulthood, where actually the invasive neoplastic changes can happen. And there is absolutely no indication at the moment that the vaccine protection wanes with time and a booster may be needed. So right now it is one-time vaccination and it is done. So again, this we can go ahead, we'll do a common group session. The next common question would be mainly coming from a lot of our medico co-parts also, that is this vaccine also meant for boys? So as said earlier, that this is a general neutral vaccine. And yes, HPV vaccine is given to boys also to prevent a whole load of oral, anal, penile cancers and warts. The last and the most important part would be obviously the cost of the vaccine. So we have, as we have rightly communicated, that there are quadrivalent vaccines and there is nonavalent vaccines. The quadrivalent vaccines are two, which out of which one, which is to spell out the Cervavac, which is used for boys and girls both. And the Gardasil 4, which is meant only for girls in between 9 and 45 years of age. 9 to 14, always the dose remain 2 at 0 and 6 months. And more than 14 years, there are 3 doses, 0, 2, and 6 months. The cost of the quadrivalents would be anywhere in between 3 and 4,000. And as we go up to nonavalent, which is Gardasil 9, the cost is actually 10,000 to 11,000. So the question then comes up, if the cost is too expensive, you can let them know that the government is considering HPV in the immunization schedule, which is already rolled out, as Madam pointed out, in 6 states. And very soon in the state of Maharashtra also, by mid-year after elections, we will have a 2-dose bivalent schedule which will be rolled out by the government for the protection of cervical cancer. I mean, for the protection of HPV.
Yeah, the Cervavac is cost price is just 2,000 rupees. So it's not even 3,000. It's just 2,000.
Right. Yeah. Right. So, again, this is the same question why they need. So we have discussed this, that it protects us from a whole lot of cancers and viral warts. And of course, what cancers are caused by HPV? We know that there are 6 types of cancers. In women, they can cause cervical, throat, anal, vulvar, and vaginal. And in men, throat, anal, and penile cancers. So does HPV vaccination really work? Again, we have said that yes, it works very well. And there is more than 90%, 95% protection when given at the right time in the right schedule. And it can prevent most of the cervical cancers. So would you give HPV vaccine to your children? Yes, they would ask you that, Doctor, aapne kya kiya hai? Have you given? Will you give it? So yes, my children or grandchildren got the HPV vaccine because it is considered very safe and it protects them from HPV cancers. Or if I had children or grandchildren who were in between 9 and 14, I would definitely get them vaccinated for HPV. So the summary, should there be a, okay, there was this one that, should there be a gap in between HPV vaccination, other preteen and teen vaccines? So this is absolutely safe. There is no interaction with any other vaccine and it can be safely administered along with your 10-year second booster, Tdap or TD, or flu as an annual shot when they come to you, or even with the COVID-19 vaccine. For people who are going abroad, even a meningococcal is mandatory, and this can also be given safely with your cervical cancer vaccine. So going to the summary post-survey a little later on. So what we today learned is HPV is a very common infection, goes on to disease in few, and of course the most important and most threatening is the cancer. It causes 6 type of cancers, as we already know. It is an extremely safe and a very effective vaccine, and not enough kids are currently being protected with this vaccination. So the key message is that we would like to share with our parents is that HPV vaccination is cervical cancer prevention. Now here it is written cervical cancer because it is going to take some time by the time which the government endorses this very officially for boys as well in our country. HPV vaccine is very safe. HPV vaccine provides a long lasting protection, and the most important that it works best when it is given on time, which is in between 9 and 14 years of age. So call to action after this module, most important is let us all be a HPV vaccination champion now on. We will be sharing all the resource materials with you, which you will review and use it for your OPDs, your clinics, your healthcare talks, your awareness lectures, which you're going to take up. Share these resources with your colleagues as well, and act on monthly prompt items which will be sent to you by the Medical Society office from time to time. Recommend HPV vaccine to all the 9 to 14-year age groups. So, of course, these posters and this material is going to be shared on our WhatsApp groups also. And the next most important step from now on would be that getting a printout, putting it up on our notice boards, making small flyers and keep it in your OPD practices so people can read it and probably come back next time and be convinced and ask for a HPV vaccine. Finally, don't wait to vaccinate is going to be a motto and a line that we are all going to remember and give it to our parents.
Can we have the role play now?
Yes, yes. So I think we are quite on time, a little bit 3 minutes, and we will quickly do a role play. So we would like to have at least a pair of volunteers, one of but the person who is going to be a doctor and one person who is going to be a parent. Now, we can have the parent doing, I mean, do you want to take 2 pairs, one for the boy and
We'll
one for the
take 2
girl?
pairs.
Or we'll
Yeah. Two doctors and 2 parents. One parent of
who
a
is
boy,
a
one
parent
parent of a girl.
Yeah, one a parent of a boy who's going to communicate to the doctor quickly, just within 2 minutes, how a parent would ask questions and how the doctor will be convincingly able to answer them. So 2 people, the first pair quickly, if somebody can volunteer, and this will be the last part after. Okay, Jagruti is one. I thought Jagruti is going to be one. And who else? Somebody, do you want to stop screen sharing, Amin?
Yeah, I'll do that. I'll have to do it again for the post
Okay, then let it be. So quickly, somebody else. Amruta, you want to
Wait, but then
share with Jagruti?
Wait, I'll just stop sharing it for some time, I think.
Yes, okay.
Okay, so who's going to be the doctor, Amruta or Jagruti? Jagruti said as a doctor, so I think let her be the parent, and Amruta, you answer her questions. You can
Sure.
use whatever language you want, that doesn't matter really. It's
All
a
right.
very
I think
casual
if
extempore.
everyone switches on the videos, it will be even nicer so that we can take a screenshot for people's.
Yeah, they need to document this for all purposes. So if you can, everybody just switch on for 2 minutes, doesn't matter. It'll be nice to get everybody's
It's
interaction.
all right if people are in their night clothes as well. That's all right.
Yeah,
So.
that's absolutely okay. Happens with most of them at this time. Okay, come, Jagruti, Amruta, you can start.
So I am a parent of a girl child here.
You decide. You want to become a parent of a girl child? Fine.
Okay. Fine. So, okay. Doctor.
Be a little nasty. Be a little nasty. Be a parent.
So can I do the other way, the boy child right now?
Boy, do boy, no problem.
डॉक्टर आप अभी बोल रहे थे कि ये जो एचपीवी वैक्सीन है वो लड़कों को भी देना चाहिए, पर ये तो सर्वाइकल कैंसर वैक्सीन है, बॉयज को तो सर्विक्स नहीं होता है ना?
हाँ, तो ये वैक्सीन को हम सर्वाइकल कैंसर वैक्सीन बोलते हैं, लेकिन इसका ऑफिशियली नाम है ह्यूमन पैपिलोमा वायरस वैक्सीन। तो ये जो वायरस है वो सिर्फ सर्वाइकल कैंसर कॉज नहीं करता, ये कई अलग भी चीजें कॉज करता है, जैसे कि एनल वॉर्ड्स है, ओरोफेरिंजियल मतलब मुंह के अराउंड के कैंसर्स है। तो ये कैंसर प्रिवेंट हम लड़कों में भी कर सकते हैं और इसके लिए लड़कों को भी ये वैक्सीन देना चाहिए।
पर फिर मतलब ये जो आप बोल रहे हैं मुंह के कैंसर्स वगैरह, वो तो अननेचुरल सेक्स वगैरह से ही होंगे ना। तो मेरा बच्चा तो बहुत ही बहुत शालीन है, वो तो ऐसा मुझे
बराबर है,
नहीं लगता है।
लेकिन हम फ्यूचर तो प्रेडिक्ट नहीं कर सकते ना, और हमारा काम है बच्चों की सेफ्टी देखना। तो अभी जो हमारे हाथ में है, जो हमें करना ही है, तो ये वैक्सीन इफेक्टिव है, सेफ है और काफी स्टडीड है। जैसे हमने देखा है, ये वैक्सीन के काफी स्टडीज हो चुके हैं और सर्वाइकल कैंसर प्रिवेंशन में इसके काफी अच्छे रिजल्ट है। वैसे तो यही सेम ह्यूमन पैपिलोमा वायरस ही इन बाकी चीजों के लिए भी रिस्पॉन्सिबल है। तो हम ये देखे आगे प्रिवेंशन तो एटलीस्ट कर सकते हैं। हम प्रेडिक्ट नहीं कर सकते कि किसी को कुछ होगा या नहीं, लेकिन प्रिवेंशन करना हमारे हाथ में है, जो अब हमें 100% करना चाहिए।
और ये आप जो वार्ड्स बोल रहे हैं, वो भी कैंसर रहता है क्या?
वो कैंसरस नहीं भी हो सकते हैं, वो कभी कभी बिनाइन भी रहते हैं, जैसे कि कैंसरस नहीं है, लेकिन वो भी एक प्रकार का इलनेस है, इनोजेनाइटल वॉर्ड्स जिसे हम बोलते हैं, जो भी इसी वायरस से होते हैं। तो ये वैक्सीन देके हम वो भी प्रिवेंट कर सकते हैं।
और डॉक्टर, पर ये शादी शादी जब भी करेंगे तभी देंगे तो ठीक नहीं है? अभी
नहीं,
से क्यों
हम
देना?
क्योंकि ये वैक्सीन जितना जल्दी दे, स्पेशली अगर हम 14 साल की उम्र के पहले दे, 9 to 14, तो जो इम्यूनिटी होता है डेवलप, वो मच बेटर रहता है, ज्यादा एंटीबॉडीज फॉर्म होते हैं। अगर हम ये 14 साल के ऊपर देंगे, जैसे 15 के ऊपर देंगे, तो हमें डोसेस भी ज्यादा लगते हैं, जैसे कि 3 डोसेस लगते हैं, और इम्यूनिटी लेवल कभी कभी कम हो सकता है। तो बेस्ट जितना जल्दी दे उतना बेहतर इम्यूनिटी है।
हाँ 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 हाँ। पर इसके बारे में ज्यादा सुना नहीं है, लड़के तो मेरे मेरे सर्कल में तो कोई किसी ने लिया नहीं है।
क्योंकि पहले जो
तो
वैक्सीन था वो लड़कों में हमें हमें लाइसेंस नहीं था इंडिया में। अभी जो वैक्सीन अवेलेबल है वो लड़कों के लिए भी लाइसेंस्ड है, तो इसके लिए अभी हमने लड़कों को भी देना चालू किया है।
और मेरा बड़ा लड़का है, वो अभी 19 साल का, 19-20 साल का है, तो उसको दे सकते हैं क्या?
हाँ, दे सकते हैं, 9 से 26 साल तक लड़कों को दे सकते हैं हम ये वैक्सीन।
ओके ओके, तो फिर मैं अपने आदमी से पूछ के आपको बताऊंगी।
श्योर, श्योर, आप आपका टाइम लीजिए,
Good,
आप
good.
जब भी आप कन्विंस्ड हो मुझे मेरे पास आइए, हम वैक्सीन दिला देंगे।
थैंक यू।
Great, great,
Good,
awesome,
good. Thank you,
really
thank
good,
you.
really good interaction. I
So,
think if we have one
Amin,
more
you
for our
can,
lady.
you can address this issue also, that if somebody has received a quadrivalent before and now knows that there is a Gardasil 9 or a nonavalent, what should he do? Probably this is also
So
an important question.
yeah, so it's a very important question. If the person is taking the nonavalent to take protection against those extra 15%, they have to repeat the schedule according to the age of the child. So if the child is between 9 and 14, 2 doses, and if the child is beyond the age of 14, then 3 doses. And if it's immunocompromised, always 3 doses.
And
Someone
all,
even asked, yeah.
yeah, Jagruti?
So, Doctor, I mean, there is this, like, I think in a couple of conferences that we have attended, they're talking about there are certain countries which just give a single dose vaccine. So, especially for people who've received a previous Gardasil 2 or, bivalent vaccine or a quadrivalent, is it okay to just give them a single dose of the nonavalent?
So the thing is, we don't have enough studies to document that, single dose may be enough or something. We all know all vaccinations, that you don't know whether the first dose is the one that induces the required immunity, or the third dose that gives the required. Why do we give DPT 5 times, that way? So you may have developed antibody at the first shot itself, or you may not develop even at the 5th dose itself. But the studies that are there is you need to complete the schedule. If you've forgotten if someone's missed out, even the gap is more, you just finish it, you don't need to restart it. So that is very clear about it. But yeah, if someone has taken a bivalent and is coming back now to take a nonavalent to get a complete protection, then age appropriate vaccination schedule has to be followed.
Sure. I think, do you want to do the role play for the girl, or should we go with it? If any questions are there directly, probably pertaining to the
I think
vaccine?
most of them, most of the girl questions have been answered
Yes,
throughout.
yes.
The
So
boy
if
was the
anybody
one that
has any
was.
questions regarding the vaccines available, vaccination schedule, whether it would change. So again, immunocompromised, even in the age group of 9 and 14, is going to take 3 doses. Otherwise, 2 doses in between 9 and 14 is enough. So Sarvavac in between 9 and 26, both for males and females. Your Gardasil 4 or your Quadrivalent 4 is going to be in between 9 and 45 only for girls. And the Nonavalent is 9 to 14 for boys and 9 to 26 for girls. Anytime if the time interval in between two shots is less than the recommended time, then yes, that has to be covered in the right manner later on. So if somebody's taken a second shot, which is less than 5 months, then he has to take one shot again to ensure that there is a better and a complete immunoprotection.
So even people who have actually have HPV in their system, even they can take the vaccine.
Yes.
Because you don't know, they could still get infected by other serotypes. There is also another common question is that the child's mother may say that I am 30 now, should I take it? So it's always on a one-to-one conversation and pointing out to them that the protection level and comfort will not be as much as it would be for the child. But it's on totally one-to-one conversation, and they understand that the immunity and the antibody response may not be as good as in the child. Someone who has had cancer, once the patient is out of the treatment, even they can take the shot. So there is no harm in that as well.
So the 13-year, 10 months, sir, very technical question. So probably that has to be taken as post 14. So he will end up taking 3 doses of the vaccine. Amrita,
So,
you want to say something?
No,
Dr.
I
Nehal,
think
if the priming,
yeah,
so
if
that
the
I'm
priming is
sorry.
done before 15
Yeah.
years, then
14,
we
yeah.
need to take only one dose.
Yeah, if the priming is
14.
done
Yeah.
before 14,
14, not
then you
15.
take one dose, then you take 2 doses only. But if you've gone past the age of 14, then it will be 3 doses. Yeah.
Yes.
So I think, Dr. Amin, when they say 14, that they mean the 14 till the 15th birthday.
Yes, 14 years, 11 months. So anything up to 14 years, 11 months, if she has received one dose, then after that, even if she's completed 15 years, we give only one dose. The second dose, I mean, just the second dose, not the second and the third dose then.
Right.
Yeah.
Right. Aditi is asking if child has received Gardasil 4 today and now wants to give Gardasil 9. Is there a gap of 1 year needed before we restart the schedule with Gardasil 9?
No, how Gardasil 4 taken today, nuance Gardasil 9. All right. So you need to anyways have a gap of at least 5 months before you give the second dose anyway. So you'll have to wait for at least 5 to 6 months before you start the Gardasil 9 again.
Okay.
Excuse me, Dr. Amin, if this child or Dr. Aditi is saying is below the age of 14 years, and if that, one sec, am I audible? Yeah. So if the child is below the age of 14 years and suppose has taken one Gardasil 4 like yesterday, and then the mother makes up the mind to give Gardasil 9, we can give it after 2 months, no? Because that is the initial gap that we are looking at when we are talking about 9 to 14 years of age.
No. So if you remember, under the age of 14 is 2 doses 6 months apart. Beyond 14 is 3 doses 0 to 6.
Okay.
So when you're
Right,
saying less than 14 years, you anyways have to have that 6-month gap.
months.
It cannot be less than 5 months.
Okay.
Yeah.
And what if
The
it is
minimum
given
gap is
immediately?
the minimum gap between the for the second dose when you're following a 2-dose schedule is 5 months, and when you're following a 3-dose, the third dose cannot be before 12 weeks of the second dose.
Okay.
Yeah, it's. I mean, if we go through the HPV module in our purple book, it's all these guidelines are very clearly mentioned. In fact, we can share that small abstract. It's just an 18-page abstract. We can share it on the group so people
That
can
can
go
be
through
put up.
all those questions. Yeah.
Okay. So I think we can take the post test and finish.
Yeah, people need to finish the post survey because that will confirm their attendance. Otherwise, that will not be marked.
And you will get a certificate also regarding that. So we'll just finish the post test.
Is this visible? Yeah.
Yes.
Yes.
Just again, either type it out in your browser or just scan it with the QR
Can you send the
scanner.
link, Dr. Amin?
I'll see.
Can't click on this.
It's on my. Actually, I had to change the computer. I had kept the link somewhere else.
If someone can just
I'll just pick it up from that.
Did you get Jagruti, or I'll share with you
No.
personal?
No, share it on the group. I think many people are
put it up.
asking.
Okay, I will do
I
that.
put it up. I put it up. I
Okay,
put it up.
okay, okay.
Yeah, thanks, Amin.
Go back to sharing to finish the last 2 slides. These are the resources that you will be getting. The link and everything, the QR codes and everything, the posters, everything will be sent to you. And Nehal, I think you should sum up this last line.
So yes, you have the power to make sure that no girl grows up in your community to hear these dreaded words that you have cervical cancer. I think as primary health givers to this age group of girls that we see in our practice, we should probably start doing this as vaccination champions today after this module, and try to sensitize and motivate most of our parents to take this vaccine either with us or very soon in the next few months in the government schedule to prevent this deadly disease and get down the rate and probably look at a dream of a cervical cancer eliminated country in near future. So I think thank you very much everybody for joining and being a part of this module, and thank you Dr. Rajesh Chokhani sir especially for being here today, and all of you.
Thank you, sir.
Dr. Purna Kurkure madam is still there? Yes,
I
madam.
don't see her.
Yes, madam is there. Madam.
Thank you.
Madam, thank you very much.
Such a
Thank you
lovely
very much for
section.
being here throughout the module,
So
our
much of
maiden module.
attendance.
Sorry, madam.
So many participants who went through this module and remained active till the end. That is
about
very important.
52 we had, madam. 52.
Yeah, 53.
I think that's a very nice number. And madam, thank you so much for being there throughout the module with us. Thank you. Thank you, everybody. Good night and wishing you all the best. Thank you.
Thank you.
Thank you.
Good night.
Bye. Good night.
Good night.